My name is Mark Saris. I've been a nurse for 4 years now. I work primarily in the intensive care unit, specifically with oncology patients. While I've unfortunately had experience dealing with deaths from nursing school all the way up, leading up to my careers as a new grad and then being an experienced nurse, I always go to this death because it really does me a full perspective of everything that's uh, c- is required of taking care of someone that's actively passing. My patient in particular that I speak of really is a 70-year-old female who is of Mexican descent, has severe GVHD, has been in and out of remission and going into relapse, and had an FDA approval for a special type of treatment. While she responded well to the treatment, unfortunately, her body could not last, and she went into full-blown sepsis, was actively dying in the ICU, and really i- it hurt to be a part of it simply because having gone through the LNEC course and seeing everything, having seen everything that this woman has gone through, and really, taking care of her for weeks on end with the family being there by her side, it hurt to have lost battle, but also it was a mixed emotion because I understood that sometimes having lost that battle really came down to uh, a new stage for her. And it meant that there was no more suffering for her. And at the very end, it really was wonderful in the sense that the family was able to be there during her final stage, and we were able to coordinate that. And that was a lot more meaningful than anything else that we could have done. After nursing school, I was definitely not prepared. Even though I saw three and was part of three actively dying patients in nursing school, I didn't feel prepared because I didn't understand what to do. Uh, I didn't understand how to approach families. And I reverted back to how many nurses were at the time taking care of patients. And that was simply trying to provide them with things, asking them for things, and that was it. Avoiding the rooms, and I knew there was something more, I just didn't know any better at the time. Talking to my coworkers was one of the best things I've learned to do. It was, I always felt that, after working in the ICU after a death, that you kind of keep it to yourself, get through the day, and then you can talk to your loved ones about it, talk to a significant other. But I realized that they don't know uh, how you're feeling and the mixed emotions that you're feeling. And having spoken with my coworkers, and speaking with people that's gone through it with you, it really meant a lot, and we were able to kind of process that emotion together. Something I wish nursing students and anyone that's new in taking care of patients that are actively dying is that you being there in the room has more meaning and does more things than anything else that you will ever do that day or that week. Really, the essence of being present in the room and being there to just listen to what they have to say, or just to hold someone's hands, even though they may not respond to you, has more meaning than anything else. You can be the best nurse and be on time with every medication, but at the end of the day, for those particular patients, they remember every single second and minute that you spend with them.